Hi, this is Dr. Scott Luper with White Spruce Medical here in Fairbanks, Alaska. And it's interesting what's going on in Fairbanks right now. We have not had a new case of COVID in Fairbanks for over a week, actually 9 days. And the question's coming up amongst ourselves and patients and other people we know is, well, when can we go back to normal life? The answer is real straightforward. It's when we have immunity. When enough of us have immunity together, then it's safe. That cutoff's probably around 60-65% of the population. So, do we have immunity? And the answer is, well, it's hard to say. You can't tell by looking at somebody whether they're immune or not, but you can test them. So the immunity testing is different from regular COVID testing. Regular COVID testing uses a PCR technology to check whether you have the virus in your body or not. Antibody testing doesn't check for the virus. It checks to see whether you have antibodies. And it's not that good a test to see if you have COVID currently because it runs a little slow. Antibody production lags behind the virus exposure. Of course it does. But it's excellent to see whether you have had COVID in the past, the recent past, or even the far past. And if you do have antibodies to COVID, there's a very good chance that what you have is immunity. And that's not proven. It doesn't always correlate, but mostly it does. Most of the time, when you get antibodies to a particular organism, it shows that you have immunity to that organism. And that's antibody testing. And antibody testing is now available. Now, research has been done on the West Coast to figure out why the cases of COVID are so much less than you would expect, so much less than what's happening in New York City or in Europe. And what they've discovered by doing antibody testing, and this is in the Bay Area and in Los Angeles, what they've discovered is there's a lot more people who've had COVID than they thought. It runs between 25 times more people and 83 times more people, depending on the research and the population they're looking at. I'll give you an example. In the Bay Area, the COVID testing right now shows that 1,000 people have tested positive for COVID. But when they look at the antibody testing and they test a percentage of the population, it calculates out to about 2% of the population. And that is from 1,000 people to about 60,000 people. So 59,000 people didn't know they had COVID. It's a possibility in Fairbanks that COVID came through Fairbanks earlier than we realize, earlier than the first cases that were identified. In fact, there's a good chance that actually happened. So what we're doing and what we hope to accomplish is to check people and see whether they have immunity. Either people who've been exposed and never got symptoms and are curious whether they have immunity, or people who got sick before COVID and recovered and wonder if what they actually had was COVID. So we're doing what we can to help our patients, we're doing what we can to help the population of Fairbanks. And what we've managed to do is get a hold of some of these antibody tests. And we are soon going to be conducting antibody testing right here at our clinic. And the results should come back within a week, and we should know whether our patients or whether the people we're working with have, in fact, antibodies to COVID, which gives a very good chance what they have is immunity. So if you're interested in getting your antibodies checked to see whether you actually have been exposed to COVID and have immunity to COVID, then contact us. Give us a call here at White Spruce Medical, and we'll see what we can do to do that testing for you. So this has been Dr. Scott Luper, Medical Director of White Spruce Medical here in Fairbanks, Alaska. And I'm asking you guys to stay safe, stay healthy, and stay in touch.